Good evening and welcome back to another episode of Everything is Public Health, brought to you by Young Health Professionals. I'm one of your co-hosts, Big Murray. We have the other co-host, the great Dr. Linda Ray Murray, and the man behind the scenes, the super producer that makes this thing possible, Dr. Dre. Today we have two special guests, Dr. Fagan and Dr. Rogers, who we'll get to in 1 second, and we're going to talk about healthcare and health insurance and what we should do. But before we get started, you know, I'm diehard Chicago. I just feel real good today. It was 65, almost 70 degrees. I can start golfing again. The Bears got Justin Fields. The Sky got Candace Parker. And hopefully next year, the Sox are in first place in the American League. Can't say nothing bad about the Cubs. So, you know, I'm happy. I'm just ecstatic. So, before we get into our show, Dr. Fagan.
Excuse me, Mr. Murray.
What's going on?
You left out the most important event of the week, or last week at least, the graduation of your daughter.
Yeah, I didn't want to get emotional. You know what I'm saying? And I try to keep my personal life away from this. But since you brought it up, first I'd like to say congratulations to all the graduates, because I can't even imagine being interrupted, you know, in your junior or senior year with this COVID epidemic going around and having to switch and not seeing your friends and your peers. But then I want to thank Dr. Rogers, my mother, Dr. Fagan, of course my family. It really starts with my wife, because you know my lovely is the one that was really hands-on with them. But the Black women that they were able to see through both their grandparents, their peers, you know, it really takes a village. So being able to see successful Black women be themselves and be strong but humble and proud, that really played an impact in her graduating, just being around it. So you got me being emotional. I don't want to be emotional. But I'm proud of her and I love her and I'm excited for her. And she just became an AKA too. I hope I'm allowed to say that, but if not, too bad. I already said it. She graduated from University of Illinois.
Good, very good. Yeah, I'm glad, you know.
All right. See, you got me off my square now. I got to get back on point. So Dr. Rogers, Dr. Fagan, who wants to go first and introduce themselves?
I'll go. I'm Dr. Rogers, Susan Rogers. I am from Chicago, a product of the public schools here. I ended up actually graduating from Roosevelt University downtown after going to 2 prior colleges. But I did my training. I went to medical school here at University of Illinois. I did my training at Cook County Hospital. Dr. Murray was a couple years ahead of me in school and County during training. I left county after that, but I came back, and I have now recently retired. But actually, it's not recent; it's over 5 years ago. But I'm still a volunteer attending there at Stroger Hospital, as it is called now. And I'm a strong advocate for single payer Medicare for all. And I am currently president of Physicians for National Health Program, a national organization of physicians who are also advocates for Medicare for all.
Doc Fagan?
Yeah, I was trying to get my unmuted. Yeah, so I'm Claudia Fagan. I'm from the South Side of Chicago as well. And a loyal Sox fan. I know you have issues with that, Marcus, but we'll let that go. I graduated from Fisk University and got my MD from the University of Illinois. And I trained at Michael Reese, which is no more. But I am internist, and I am the national coordinator of Physicians for a National Health Program. And my day job is I'm still working, and that's the chief medical officer for Cook County Health. So I believe that healthcare is a right, and that we're not going to be right until we guarantee access to healthcare for everyone who's living within our borders.
Well, somebody explain to our audience what is single payer? What is Medicare for all? What is it?
So I could just explain to you this way. I mean, we have a simplest way. We have over 1,000 different insurance companies in the United States with hundreds of different plans that people belong to. And the idea that people either have to purchase insurance or the government pays for it makes no sense. So what if no matter what the medical needs that you had, the government just paid for it? We guarantee access to education in this country. Public education is free. There are costs associated, but it's basically free. It's paid for by your tax dollars. We guarantee everyone right to fire protection. We have a fire department that if the house catches on fire, you call them, they come and they put out the fire. And I think that the richest country in the world that spends so many billions of dollars to destroy things could easily afford to pay to provide access to healthcare for everyone in this country. We have a long way to go after that, but I think that's a starting point in terms of, at the very least, you shouldn't worry about the bill. You should worry about the care and what we think is good care. I think once everyone has equal access, we can discuss what we think medical care should be. But when we say Medicare for all, we say that because that's something that people understand. People over 65 understand what Medicare is, and it's a very popular plan. So what if tomorrow morning, we went to bed tonight and we got up tomorrow morning, everybody was covered. They all had Medicare, and that meant that they could go and get care. Now people have gotten into these crazy Medicare Advantage plans, which are not the same, but they could go to any doctor or provider that they wanted to, and they could be assured that their bill would be paid. So.
Now here's the thing. Some people I know on Medicare, they have a copay. What about the copay aspect for what you're talking about?
Copay is a way to limit access. People who pay copayments, even when a copayment is only 50 cents or $1, discourage people from necessary care just as often as unnecessary care. And that's been proven several times. The Rand Corporation did a study where they, back in the 70s, where they were charging copays of 50 cents or $1. And they saw that people made bad decisions based on their copay. If you have to decide between a copayment and car fare to go to work, you're not going to necessarily make the best decision for you. So we're talking about a plan that does not have copayments, because we don't, copayments cost as much to collect them as they do that you may collect, and they're only used to deter people from getting care. So no, we're talking about a plan without copayments.
So is there a model, and this is to everybody as well, is there a model that maybe the U.S. can look at that's successful, that the average common person could go and say, okay, I'm gonna go on YouTube and I'm gonna look at this model?
Yeah, I'm gonna. I will say that the United States is the only industrialized country in the world that does not have a model that guarantees access to health care. So, you know, there are several different models in terms of how you do it, but everybody else has figured out how to do this. And so you could pick a country and I could tell you about the model.
Okay, I got a country, Canada. Now, in Canada, it might take me 12 months to get a some type of a colonoscopy.
No, that's not true. That's not true. And so that's just propaganda, Marcus. I mean, that's just what folks like to say. The difference between Canada and the United States, a big difference, is that they prioritize people based on their need. And so, yes, they do have waiting lists for certain procedures, but you could call up a doctor to try to get an appointment for a physical, and they might not be able to see you for, depending on your insurance, might not be able to see you for several weeks. The difference between Canada and the US is that Canada keeps track of it, and they have waiting lists where people can see. And they even have shown, you know, if someone, for example, needs heart surgery, the studies have shown that if your primary care doctor or your cardiologist said your need was urgent or emergent, you move to the front of the list, and you were going to get that surgery within 48 hours. We don't keep track of that. We don't know how long people wait because we don't have an organized approach. You know, you try to get in here, you can't get in here. You try to go somewhere else, and nobody's keeping track of whether people are waiting or not. They actually track things like if you're waiting for a knee replacement or you're waiting for a cataract surgery, and they can tell you based on province where how long it will take you to get that. And if the doctor thinks that your need is more urgent or emergent, you get pushed to the front of the line. The difference here, if we told Americans they had to wait in line to get a procedure, they'd reach into their pockets and say, how much does it cost to get to the front?
And so, you know, that's the American way. But so what's the problem then? It sounds like a good plan. It makes sense. What's the problem? Why hasn't America jumped on the bandwagon?
Well, one of the things here is that we don't see healthcare as a right, as Dr. Fagan was saying in the beginning, how we all can get a fire put out because that is a right to access the fire department. We don't see healthcare as a right. Delivering healthcare is a way to make money in this country. It's not about trying to make you healthier or trying to address the needs you have regarding your health. It's a way to make money. And so the system is set up so that people who are not able to pay for it do not get it, regardless of what their need is. And that leads to the inequities that we see here. It's a system that is not based on delivering health care to people who need it. We have a system that is based on making money, whereas Canada is more concerned with making sure that everybody is healthy, which is what a country should be doing. It functions better if everyone is healthy.
So who would pay for this?
We all pay for it. We pay for it when we don't provide the care.
Right.
So let me say, break it financially. Who's responsible for the bill of a person visiting a doctor or getting screened? Like who? Like the government? You want the U.S. government to pay for that, and where would the money come from?
Ways. It would all go into a pool to the government because the government is going to end up paying the bill, but it would be paid either through taxes from your employer. If you're not working, you're still entitled to it. And that's what we mean by healthcare as a right. I pay taxes to the public schools, but my children are grown. So that's part of my contribution to the public education system. And I will pay taxes to support the healthcare, whether I have to use it or not. And so there will be enough money from everybody paying either their income taxes or other taxes that is going to be a whole lot less than what they're paying for their employer-based insurance now, or the additional copays and money for drugs right now. So there is money to pay for it. Right now, we pay almost twice as much as every other industrialized country for healthcare, twice as much per person as every other country. Yet, we have the lowest life expectancy. We have the highest infant mortality. We have the highest maternal mortality. So we're paying twice as much, but getting nowhere near as much. It's just like you wouldn't pay twice as much for a car and get half a car. But that's what we're doing. We're paying twice as much for not even half as much.
And I think one of the problems we have, and that's why we have so much trouble with this debate. So in the 1800s, Germany, late 1800s, Germany and some other European countries began having social insurance of some type, where they collectively said, we're going to provide, food, whatever, for our population. So one of the problems we have in the United States is not only do we charge so much money and spend so much money on medical care, but we don't really consider what healthcare ought to be. So all these things we're talking about, we're talking about medical insurance to pay for medical things that we do in hospitals and doctors' offices. We don't think about the fact that, look at what happened during the pandemic, that in other countries where you have parks that are well kept and maintained that people can get out and be active in, that's part of how you keep people healthy. Countries where you have good unemployment insurance, so if you get laid off from your job, you don't starve to death. So as a society, we don't put a lot of money, invest a lot of money in our people. And that's why certainly Blacks and other people of color, poor people, working people, as we saw during COVID-19, are really in big trouble. And so the medical component for medical insurance is just the top of the iceberg that's easy to see. It's horrible. And I certainly have had patients that get colon cancer because they don't have health insurance to get the colonoscopy. So you can talk about real tragedies. If you don't have medical coverage, we know people die. They die in this country and they die in other parts of the world where they don't have access to medical care. So when we talk about a human right, that means it's a right just because you're living and breathing. It shouldn't matter what kind of insurance you have or who you know or what hospital you go to.
Well, so here's the thing, and I think it does matter who you know and what hospital you go to, because I love the county. But here's the thing: the message that you all are saying, and I agree with it, but I'm still gonna ask questions. We're from a different generation, and even once we reach a certain age, we start thinking about our health more. The young people have basically been behind every movement across the world. I'm talking about 16 to 25-year-olds. They don't even think about health insurance. They don't even think about ailments and things of that nature unless they have pre-existing conditions. So if we don't get them on board, and get them more active at a young age, by the time they get 35, 40, have children, you're not as progressive out there, So we need these young people. I need you all to break it down in layman's terms to the young 18 to 25-year-old why they need to put this on social media and start putting pressure on everything else they do in society when they want change. So what would you say to them? What would you say to my daughter that's 21, why it's important for her?
Well, even young people need health care. They need some preventive care. Your daughter will need reproductive health care. She will need birth control until she is ready to start a family. So there's things that people need regardless of their age. Accidents can happen. Even though they may not have chronic illness yet, they do have healthcare needs. It may not be continuous, but it is an issue. And I think that if you ask any person in that age group, they know somebody who has needed health care. So it's to their benefit that they can access that care if they do need it, whether it's for an accident, a trauma, an acute illness, an acute infection, or if they have a chronic disease. They all still need health care, and they can look at their parents who are still are younger. They need the health care too. And so it's an ongoing thing. Even babies need health care. We all need things. And even though we don't see ourselves necessarily as being sick, and Dr. Murray mentioned it, that we have more of a sickness healthcare system rather than a preventive healthcare system. We're more worried about we focus more on treating people once they're sick versus doing the things to keep them healthy. And that's one of the things that's different in other countries. They spend more money on preventive care. Right now, an insurance company doesn't want to do that colonoscopy you mentioned, because the way people change their insurance companies, it's not going to be their problem. So they don't want to look for a problem they may have to take care of. They'd rather just ignore it and wait till it becomes a bigger problem and it's somebody else's issue.
This will make a lot of difference to your daughter, who can no longer go to the university health service if she has a complaint or a problem. And I know a lot of, being the mother of a couple of them, a lot of young adults who experience a hassle if they decide they have a problem they want to ask somebody something about, because either they don't have insurance, because they're working in the gig market, whether they're bartenders or Uber drivers or whatever. They know that even if they get a bad cold, or there's no one that they can turn to and call without it costing them money. And those are hours of time that they spent earning that money. And a system that provided equal access would make their lives much easier. They all get problems with, simple problems, but problems that can be really, with a simple urinary tract infection, or wanting to have birth control pills, or, having bad allergies, and just not having access to someone they can discuss that with. They understand what that means. They understand that they don't want to get a big bill. I had a huge fight with my son who had an infected toe and didn't want to, I said, you don't have a doctor. You're going to have to go to the emergency room. And he knew he didn't want to go to the emergency room because he didn't want to have that bill, to pay. But, I don't know what it is about men and their feet, but the infection got bad. He did wind up in the emergency room, and he's still paying that bill off 5 years later. So it could have been prevented, but it wasn't, because he didn't have regular care. And once they have that experience, they never forget it, and they try to avoid it like the plague. But this affects them, just because they don't necessarily have high blood pressure or diabetes, they have problems. They want a solution. They don't want it quick and easy, and our healthcare system is not geared for them.
But I think you raise an interesting point, Marcus, because I think we're talking different languages to young people. So one thing I'll guarantee you that young people, especially today, will think about is behavioral health, mental health, and stress. So I haven't talked to anybody under 25 that hasn't been especially concerned about that normally, but especially during this pandemic. So they're aware of how much problem stress and anxiety can cause to them and their friends. Well, we don't do that very well in this country in terms of our medical care, but it's something that ought to be included in what we take care of. And there are things we can do both individually and as a society to help decrease the stress on kids. So a lot of things that concern young people, they don't think of as quote unquote medical problems, which is fine, but they know that they're problems that impact their health, their inability to hang out, their inability to have a stress-free future, their inability to see going to school as a productive activity and not something just to beat you down. And I think we have to say to people, we can organize the resources we have to help people live a healthy life. Whether you need treatment for an infected toe, whether you need individual counseling for a problem that you're having, or whether you need to restructure high school so it doesn't drive people crazy.
So let me ask you all this then, because this is what I think. And I agree with you. I think the young people, we need young soldiers, and they need to understand about health as a human, as just a human right. Is that the thing we need to stress in schools more and to our young people? Because looking over this past year, and you're thinking about the protests, we always said police brutality, the prison industrial complex. We always hear things like that. You never hear young people and people talk about healthcare, except for the generation that's basically getting AARP cards, and nobody's listening to us. So is it something we need to do with our young people, in the public school system, is stress their importance for healthcare more?
If we talk about Black Lives Matter, we talk about why do we die younger? Why do we, have more complications? And, I look at the patients who come to us through at county, and you have people who are, in their 40s who have 60-year-old bodies because they paid the price of the stress that our society imposes on people of color. And I think it's important to help folks understand these disparities aren't by accident. The fact that we, die younger is not by accident. And part of it is our access. If you look at, people do better when they can talk to the problem, whether it's about stress or a health problem, if they have someone who looks like them and talks like them, right? Someone who understands, who can meet them where they are. And those are not the folks that they see as doctors, right? Or nurses. That's not who they see, because we know that there are fewer Black men in medical school today than there were in 1975. And that as a result of that, people don't have a healthcare provider who can talk to them and hear them the way we talk and what we want to hear. And as a result of that, the system fails us time and time again, all day, every day. And, the fact that, like I said, we get sicker and die younger, it's not by mistake. And I think that the same folks who are marching out there talking about Black Lives Matter, this is part of how we make them matter. This is how we make a difference. If we want to live longer and be healthier, we have to have folks who can coach us in the things that are going to make a difference in our lives. As Dr. Murray talked about, figure out how high school should be reconfigured so it's less stressful or anxiety. I see the young people today, the teenagers and the 20-year-olds who have a lot of anxiety and stress, far more than we did at our age. Even though we were marching in the street at that time, we didn't have this, these pent up feelings that folks have problems with. So I think if we want to help young people understand that this is all part of the same problem, the things that they have anxieties about, the same things, the fact whether we can't get a job or we don't get education or we don't have doctors who care about us or are going to take care of us. So making it part of that problem, this is a social justice issue. We should be clear about it. It's just as important as the issue about arguing about access to education. Arguing about access to healthcare is going to make an important difference in our lives.
I totally agree. I was trying to feed into the question because it makes me think about it just in my short period of life, and you all might have more knowledge on this than me, is that that fight for rights for healthcare has always been left out of our struggle. The only person I could think about where it was in almost my lifetime was Fred Hampton and the Panthers, and you see where that got them. They kill us for that. So on that note, when we think about it, it's not a coincidence. What we're talking about is eliminating insurance companies. We're talking about eliminating Blue Cross Blue Shield. These are billion-dollar Fortune 500, companies, and they're not going to go without a fight. So how do we change the narrative with the propaganda? Because not only are we fighting the truth, we have to fight the propaganda that people see, the concept, graduate, get a good job, get good health insurance, as opposed to, have the government provide our health insurance. But
so one of the huge challenges is knowing that there are 3 lobbyists for the healthcare industry for every single member of Congress. So one of the things, hating to talk about electoral politics, but we elect people who are in the back pocket of the insurance industry. And we allow them to make our laws and legislation. And so until we crack that, until we haven't even got a toehold in there, right? Because the people who are dictating the laws that are going to be passed are the people who are profiting from it. That huge industrial complex that, has no interest in making sure that everybody, as Dr. Rogers said, the health industry is geared for making money. It's not really geared for taking care of people. The Panthers got that right.
Yeah, one of the things too is this country is so focused on having health insurance, and health insurance means nothing. Just because you have insurance doesn't mean you have access to care, because there are now high deductibles. I think people don't even understand how much they pay for this insurance before they have seen 1 penny's worth of health care. They take out of your paycheck, sometimes up to a health insurance plan for a family of 4 costs almost $25,000. Let's say your company pays, 50, 60% of that. You're losing out of your salary several $1,000s a year. You don't ever see that money because it's not in your check. So you don't even see that money, even though it should be yours. Then after you get your check, you still have a high deductible to pay, several $1,000s before you can access that health care. So you've got insurance, but you don't have access to care because you cannot pay for your deductible. It's no different than somebody giving you a car, but not the keys. You've got the car, but you can't drive anywhere because you don't have the keys. So you've got an insurance card in your pocket, but if you can't pay the deductible. So what has happened is that this whole idea of having insurance has, just overwhelmed people into thinking that that gives them access to care. With a single payer, Medicare for all, it's not insurance that you have healthcare access from day one without spending a penny, other than what it costs for you to get to wherever the place is for you to get the healthcare. And so people have to understand that insurance doesn't assure that you have healthcare. Medicare for all will assure that you have the health care you need. It will cover everything that's medically necessary without any out-of-pocket expenses.
Well, yeah, so that's the whole thing. It's the illusion of insurance. It doesn't protect you. More than half of the bankruptcies in the U.S. Are for medical illness or medical debt. And the overwhelming majority of people were insured at the time that they had the inciting illness or debt. So the insurance doesn't protect you from going bankrupt with the cost. It doesn't adequately cover the cost of the health care that's delivered. It makes no sense that you put all this money into the insurance companies, and what they do is you pay them to limit your access to care and decide what you can and cannot have. So, Susan's right about that. We just need to get away from the notion that we need to be insured. We just need to have the government take this responsibility. And you're right, it's a multi-billion-dollar industry that's not going to go quietly. But as I said, this is a social justice issue, and this, like every other social justice issue, is one that's going to have to be people organized in the streets. And politicians don't ever lead a movement, but they do know how to run to the front of the parade when the movement has taken off. So the way we overcome this is that we take to the streets and we make people understand how important this is and how it affects our daily lives, and that politicians who don't understand this, we don't want them representing us.
So I think young people, I was going to say, I think young people intuitively understand this if we speak their language. So basically what you've pointed out is that the 1,000 insurance companies that we have, medical insurance companies we have in this country, are basically stealing money. And they're stealing money from young people especially. What does that mean in English? That means we are paying ridiculous amounts of money, both out of our check and, just as importantly, what our companies pay that don't come in our check, but it's still part of our wages, in order to overpay this medical industry, especially the insurance companies and the pharmaceutical companies that make the vast amount of profits in our industry. So if we had a single payer tomorrow, the first thing that would happen, I would argue, is that young people, if they're fortunate to have a job, their pay would go up. How do I know this? Let's look at the auto industry. In the auto industry in North America, you have auto workers that make Ford, General Motors, north of the border in Canada, and you have them south of the border in the United States. In Canada, where they have a Medicare for all, basically single payer system, they don't have to negotiate on that in their contracts. And they're able to get other kinds of things, more vacation days, higher pay than the American auto workers. So the reality is, what we should be talking about is that these insurance companies and pharmaceutical companies are thieves, and they're stealing our money. And when you're young and don't have as much money as when you're older, you especially should be upset about that. These people are reaching into your pocket, whether you have health insurance or not, and taking money that rightfully belongs to you and belongs to society. So when we talk about providing coverage for all with our present resources, we could do that so much more efficiently and so much cheaper, frankly, if in fact we had a single payer medical system.
And I definitely agree. And one of the ways you change the narrative is telling the story, and you all just gave clear examples. It's just that we have to think a little bit outside the box too. I believe in taking it to the streets and speaking to the way that people need to be spoke to, but there's going to take a financial fight from people on this side to even fight that propaganda of wanting health insurance, explaining what single payer is. Just like that whole defund the police movement. We have to make this movement cute. We have to make this movement acceptable. We have to speak to it not to 35 and 45-year-olds, to 15 to 20-year-olds, and let them know, hey, the government is stealing your money. This is what you deserve. Add this to your list of protesters. So how do we fight capitalism on that level as well with the social justice movement?
I think we have to connect the dots. And so we don't do enough of that in this country. We're afraid to say when something's racist. We're afraid to say when people are stealing. Look at poor diabetics. Insulin, I don't even remember when insulin was first invented, but it's decades old medicine. It's going through the roof now. If you have to buy insulin today, you'll go broke. So we just allow these companies to invent reasons to steal money from us. And we have to start using that language. Even the vaccine companies during COVID, there is not one piece of the COVID vaccine that was not paid for by people all over the world. Our tax dollars went into all the research on which it's based. We guaranteed profits for these companies, and they're still trying to rob the world blind and not vaccinating most of the people in the world that really need the vaccine. So we need to call these thieves out. This is something young people understand. They're worse than the cable thieves or the telephone thieves. People are into it. They're worse than that. They steal more money, and they do it in a way that's immoral, because when they steal money and restrict access, people suffer and die.
And is made us believe that we need choices of what kind of coverage we need. You know, that we need to choose between a Blue Cross Blue Shield or Aetna or a Cigna plan. We need to have choices, because what I need may be different from what you need. But what's going to happen to you next week? Neither of us know. So we both need to be covered for whatever, whether it's going to be a broken leg or a leukemia diagnosis or a infected toe. You need to be covered for everything. And that's what Medicare for All will do. So this whole talk about choice, what we need to have choices about is what doctor we want to see, what healthcare facility we want to go to, not a choice of an insurance plan that's just going to deny our care and take our money. We have to think about what are the real choices that will make a difference.
Now, I want to ask my colleagues here, because they're much more disciplined than I, and they, even though I'm a member of the Physicians for a National Health Program, they play a leadership role, put in a lot of hours. But I also believe we have to change our cry from simply Medicare for All. That if we put as piece of that we would try to address and eliminate racism in medicine, that we would make sure that there are opportunities in the health professions field. That's something young people are interested in, not to be just a doctor or a nurse, but all the other myriad professions that exist in healthcare. And we know in many of those professions, the number of people of color is going to continue to decrease. For example, physical therapists. When we were young, physical therapists was a bachelor's or master's. Today, entry level is a doctoral level degree. With nurses and nurse practitioners, I predict that's going to become pretty soon at a doctoral level entry is minimum. You can still do some of it as a master's, but more and more places are going to a doctoral level degree. And when we do that, it makes it more difficult for working class people of color to gain entry into these professions. So if we tied all of this stuff together and connected the dots and talked about money being stolen from your checks, parts of the careers and futures being shut off because because racism exists and you can't get into the schools, to not covering things that we need like behavioral health and other things, then I think we can be talking about more than simply Medicare for All, but we really can be talking about healthcare as a human right.
So you're talking about transformation. I mean, and it goes back to this whole thing, the way in which as people of color, we're limited to education, to higher education, because you have these proprietary schools that take all your money and don't necessarily provide you with a degree. You know, we don't get into the pipelines. You know, there are a lot of, as you point out, a lot of profitable jobs in healthcare, whether it's physical therapists or respiratory therapists or x-ray technologists. I mean, you know, we can't even hire enough folks to be the radiology technicians. And yet our folks don't even know about that as an option for going to school, that's something that they could get a certificate in and they could make a nice living at. So, you know, time and time again, we find doors shut that are open for other folks. And, you know, I agree that we have to be more than a Medicare for all. That slogan is only because it's something that people are familiar with and, you know, recognize what that is. But, you know, talking about single payer is always talking about society. And as I said, you know, at the beginning, you know, that's just leveling the playing field. You alluded to it earlier, Dr. Murray, in terms of talking about health as opposed to medical care. You know, we don't have access to health, you know, so insisting that we provide access to, someplace safe to exercise, you know, that we provide access to food that's safe to eat and clean water, you know, all of these things that are important. But, you know, starting with providing people access to care, then people are more invested in what care looks like and what that means when you say access to care. Then you might have a say. If everybody had to get in the same line for care, they'd have more concern about what you get when you get to the front of the line, you know, and what that means, what that represents. So this is all about, talking about how we have been excluded from the decision making in terms of talking about what represents healthcare. You know, so, you know, your doctors have defined for so long what people should have, but you know that might not be right for me. You know what doctors prescribe in terms of I might need to have someone who helps me to meditate. I might need to have someone who can coach me in terms of my diet. And you know these are things that we have never really talked about in broad terms. So yeah, we probably need another slogan, but you know, we need to talk about, we have to be in charge of our bodies. We have to be able to have a say about what our needs are and discuss that. And this is just the beginning. This is a financial conduit. This is saying we're spending enough money on healthcare. We're just letting too many people who are not involved in the delivery of healthcare take profit from it, instead of talking about how we could more appropriately distribute it and what it might look like in my neighborhood as opposed to another neighborhood. So I think it's all part of a bigger picture. We really need to have that conversation about what we think healthcare should be.
And so just to be clear, in this single payer, we are talking about preventative services, mental health services, all the things you name, just
right.
So our audience understands we're not talking about just if you break your finger going through the emergency room or through the healthcare system that
Not
way.
at all.
We're talking about preventative screening services, behavioral health, mental health, things of that nature. Okay.
You can get your eyes examined, your dental care, long-term care for older people. Disabled people won't have to be living in poverty to have Medicaid so that they can have their health issues addressed. So it would cover all of that. But one of the things, God, I'm blanking on where my train of thought was. Oh,
what I just want to mention is that I've seen this in action. I've seen this work, because how you would spend your healthcare dollars are quite different in the Bronx in New York than they are in, say, Miami. All right. And so I remember that, in a tiny town called Prince Albert in northern Saskatchewan, the health district was run by a guy who was a cattle farmer. And when he realized that they were spending so much money on low birth weight babies, that he hired an army of nurse practitioners who went to visit people in their homes and looked at the nutrition and what food, whether people had access to groceries. And by doing that, within a year, they had increased the average birth weight of those babies. And those babies then stayed in the hospital less time. They saved, literally, for that tiny little area, they saved tens of thousands of dollars, which allowed them to invest in housing for seniors so that they didn't have to go, to the big city to be shut away in a nursing home. They built subsidized housing for seniors in the backyard, on the back acreage of the hospital, where so those folks could then live in their own independent homes. They could go to the hospital to have a hot meal at midday, and yet they continue to live in the community and be contributing members of the community. Now that's innovative thinking, but that was meeting the needs of that community. And giving people control over healthcare, it's empowering and offers opportunity to think about, what does this community need to be healthy?
With a profit-driven system, they're not concerned about what the community needs. They're concerned about making their profits. So even though there are issues, if you look at any large institution that, has billions of dollars, that they're sitting on, you look at like Cleveland Clinic in Ohio, which is, it's an incredibly high standard of care. People come from around the world with cash in their pocket to pay for that. Yet, right across the street, there are some of the worst health statistics in the entire state of Ohio. They're not even welcome to go to the Cleveland Clinic to get their blood pressure taken care of, to get their diabetes taken care of. So they're not part of the community. There's this whole separateness that they're there to make money, not, as Dr. Fagan was saying, they're not there to improve the health of the community. And that's one of the things that if everybody is in the same system, as long as the wealthiest people are satisfied with that system, then everybody will get covered with that, because you can't have different tiers of care like we have now. We have Medicaid, which is poorly reimbursed, and it just tells poor people you're not valued because we don't really pay for their care. We don't provide them the care they need. And so it's this whole financial aspect to healthcare here that is just destroying it. It's just destroying it. And even now, with all the inequities, the fact that the wealth gap is worsening, it makes it even more difficult for Blacks, poor people, people of color to get the education they need to get into the system, to be providers within this system. It's a very intertwined system based on white supremacy that is going to be very difficult. And Medicare for all is one piece of it. It's not going to solve the whole thing. None of us are disillusioned about that, but it's still a necessary piece, because if we aren't healthy, we can't fight for anything.
Go ahead, Doc.
No, I was going to say, so the challenge is what you've outlined earlier, which is how do we put together the political alliance that we need to pass legislation? This has been tried in the United States for over 100 years. Things have been put forward to pass it. And to be honest with you, while I wasn't around for all of those, the most universal and the most radical one was really during the same time we were discussing Social Security, when universal medical coverage was pulled out of the legislation that created Social Security. And so since then, we've been going backwards. So when Richard Nixon was president, he proposed health legislation and medical insurance. And at the time, all of us activists laughed at it and said it was horrible. But his legislation actually is much better than what we have today. So we've been steadily going back, and we haven't confronted the real underlying falsehoods. The notion that you somehow can be healthy when other people are sick. The notion that it's an individual responsibility, so you can personally wall yourself off, but you can't do that. And my health depends very much on what other people's health are in the city of Chicago and around the country and around the world, for that matter. So it really does mean recalibrating how we talk about this, and understanding that if we're all human beings, there's certain things that we have a right to, and the ability to be healthy is foundational among those rights.
So let me throw this idea out there to you guys, and I want to see what you guys think about this. To me, health is a taboo. People don't like talking about healthcare, just the average person that's not in it. So it's not cool. In order to make it cool, people need to understand it. To me, there's a disconnect between those who know and those who don't know. Meaning, if I was to throw all three of you on some type of mass media campaign where they actually put you on TV and let you talk, the young people will sign up and they will support it. So is this something we have to do, like in terms of our strategic art of war? Is find some person, some financial entity that believes in single payer to start pushing out propaganda in the proper way, healthcare for all, healthcare, human right, telling some of these stories without using particularly your son's name, telling some of these stories to have people think about healthcare, changing the narrative. So let me break it down to even more simpler. The people that suffer the most in society let me start off. The employed people that suffer the most with healthcare are entertainers. I like rappers and actors. You'd be surprised how many of them don't know anything about healthcare. They don't have healthcare insurance. That little SAG union card they get doesn't cover anything. They come out their pocket. In conversations with them, they wish they had known earlier. Is it something you all creating some type of documentary, and not necessarily you three, but people like you three, real life people with good titles that people will honor and respect? We're talking about Black folks, because we're not gonna honor some nutritionists if they don't have a title we don't honor. So 3 powerful Black women as doctors come out with some documentary, breaking all this down, getting these entertainers on your team. Is it that we need to have meetings like they did back in the day with Jim Brown and Kareem and all those brothers, and sitting down with these Cedric the Entertainers and Jay-Z's and Commons and getting them to be our influencers? Like, we have to do something.
Yeah, but first of all, they ain't gonna watch a documentary, that's for sure.
They would sit down. So here's the thing: they would sit down and listen to you guys and respect you guys, and as a sponge, they will repeat that knowledge. They'll sit down and watch documentaries
You
on
have
Black
to meet
men
people where they are. Right. You have to meet people where they are. So yeah, you're onto, in terms of talking to the influencers, right? And talking in a media, whether, it's got to be like a Twitter or a TikTok, or, even Instagram has gotten to be old. Don't even mention Facebook. But, it's talking to influencers about the things that the problems that they encounter on a daily basis, trying to get this. And so my daughter, who's an artist, and when I talk to her friends, and some of them are performers, they do poetry slams, and you talk to them about their health issue, it's real for them. So I think that a successful campaign, you talk to influencers and they tell their stories about not being able to get what they need, even though they are well known, even though they do have some, financial means, when Dr. Murray started talking about how Nixon had a proposal, every president since Theodore Roosevelt has tried to get universal health care. And it's because they each were affected in a way that made them understand that nobody could possibly afford it. In other words, so Eisenhower knew it because Mamie's father had a horrible stroke. Nixon knew it because he had a brother who had tuberculosis. The Kennedys knew it because they kept Joe Kennedy alive for years at a cost of hundreds of thousands of dollars after he had a massive stroke. Each of their families, Franklin Roosevelt had polio. I mean, each of them encountered healthcare because health, illness or disease does not discriminate. And each of them understood, even though they might have the financial means, that most people would not. So the campaign is about talking to, young popular influencers now, and they've already had encounters that help them understand why this is an issue. They don't like to talk about it, but most of them have had at least 1 or 2 encounters that was less than satisfactory. And you talk to them on the media that people use today. People don't read the newspaper, and but they do watch the internet, the various media, and that's how you begin to move this needle. You have to have these conversations and make it real. And telling your story makes it real.
I understand, but I don't want you all to think. I don't want you to think that this multi-tier approach and the influence that you would have as a Dr. Fagan, CMO of the second largest public health system in the country, your knowledge even break it, and Dr. Rogers and Murray, you all's knowledge even on this past show, the past hour, of breaking down the intricate details of health insurance, how it works, single payer. Some people, they need to hear that from you. So I agree with you. I just think there needs to be some platform where people like you guys are breaking it down where a sixth grader can understand it. Like,
my biggest success today, I saw a patient today, a 66-year-old woman who hadn't gotten the COVID vaccine. And I spent time with her answering her questions and helping her understand why this was important for her to do. She was scared of COVID, but by the time she left the exam room, not only was she going downstairs to get her shot, which we could arrange for her to get today, but her husband, who was in the waiting room, he was going to get it too. So I know that we can make a difference, but we do have to meet people, answer their questions and help them, as you said, break it down. And that's what we do all day when we talk to patients.
But I do think, even though no one thing is going to work with everybody. So I do think how we approach this and who we go to for help to help us tell this story. So, for example, discussion in our community around mental health, I think, has improved a lot in the past 10 or 15 years because we've had public people, especially celebrities and sports stars, talk about their personal problems with mental health. So I think that does help. And I do think that we could use some creative people to help us begin to discuss how the medical system works. I just wanted, this is a commercial for something that I have no real relationship to. But for example, next week, there's going to be a whole 4-part series about Black people's diet and our cooking contribution to American culture called High on the Hog. So I think if it takes now normally you would think that sounds like it's going to be boring, but if you have good filmmakers, they can make it interesting. The other thing I think is critical, in addition to explaining this to people in whatever format you can, is to help people see how healthcare and medical care is part of things they already care about. So for example, if you're a young high school athlete and you're trying to make it into college athletics or maybe professional athletics, to talk about what it means to have not only good health, but what you need to stay healthy, what exercises you need so that you don't end up with a bummed out pitcher's elbow before you hit 20. So in every activity that people are interested in, health is an important component of that. So one of the things we have to do is help people understand, coaches, for example, or other folks, how health is connected to the area that they work in and they care about. So it's both of those approaches to explain the medical care system and our healthcare system and what it's doing and not doing, but also to allow people to understand, I want to play video games all day. Well, you need to think about how to do that in a way that your thumbs can still work at the end of the day.
One of the things too that I think is really affecting, people of color and poor communities is that we often look at these issues as if everyone has choices, but a lot of people don't have any choices. If we look at like the pandemic exposed frontline workers, I mean, they had a choice if they could either go to work and risk being exposed to COVID and bringing it home to their crowded household, knowing that everyone could possibly get it, or they could not go to work and then become homeless and hungry. So there's no choice here. There's no good choice. There's no good way out of that situation. And that situation where people are struggling for survival every day makes sometimes things like healthcare an abstract issue because what they're concerned about is more day to day. And I think that this is part of it, though, because the fact that they are frontline workers is creating a health issue, and the fact that they have to bring it home is creating a health issue. It is all combined and interrelated. But I think that sometimes that so many of our people are focused on just struggling to survive that they don't they don't have the time or take the time to listen and grasp these messages. And, you know, I think that one of the key things, and I'm not sure what's the right way to say this so this comes out right, but there's more poor white people who are disenfranchised from all this than there are poor Black people. But poor Black people, poor white people, their life is okay because they're not Black. And as long as that's their goal in life, is to not become Black, they'll tolerate the total lack of health care for everything. And until they acknowledge that they could benefit from it'll all just flow. But that's another big piece of the problem, that we have to be able to make everybody realize that everybody benefits. And just because Black people benefit, it doesn't mean that it's taking away from what white people have. This zero-sum game, you know, is not really the issue here. Everybody, as we've all said, when everybody's healthy, everybody's happier, everybody's healthier. So we all function better when everybody is healthy.
I definitely agree. I definitely agree. As we get ready to run out of time, I want to go around and ask you all. First, I want to thank you for coming on. And I just want the audience to know, you know, Dr. Rogers and Dr. Fagan are like family to me. So some of the questions I was asking, it's really, you know, they know behind the scenes. They're intelligent people. I'm always around them. I just want, and as well as my mother, I want to share their intelligence with the world because I know they can influence a lot of people. So I try to put pressure on them just to be out there a little bit more for us young people. But before we end it, we'd like to go around and ask you if you want to add anything, say anything, and it could be about anything. So Dr. Fagan, you go first, please.
You're on mute.
We've got a lot of work ahead of us, but, you know, I'm just going to reemphasize something I think that was said more than once, Steve. It's, you know, none of us is healthy, or none of us are safe until all of us are safe. So I'm going to encourage everyone to get vaccinated. And I think that we have to fight for our country, which has sucked up all the vaccine. And I talk to people in other countries who don't have access to it. We need to make sure that the world has access to vaccines to help battle COVID. I mean, it's really frustrating to me that we have been so short-sighted and so selfish. You know, we have a vaccine that we have sitting in storage, and there are people who are having to wait months to get access to a shot. So it just points out the disparity this country continues to perpetuate on the world.
Sad. Dr. Rogers?
Yeah, just to, you know, expand on what Dr. Fagan said, this whole idea that I think we have to acknowledge that the world is small and we're all in this together. And it's just as important as this country be healthy as the next country be healthy. Because as the astrophysicist Neil deGrasse said about how in the swimming pool, that you can't just have a peace section in the pool and then think the rest of the pool is okay. So you have to be we have to be healthy, just as the next country has to be healthy. As individuals, our health is dependent on the person who's next to us, our health. And it's the same thing with climate change, the destruction of forests, the obliteration of natural resources. We're all connected here. And this individualism is destroying things. You know, it can't be, well, I'm okay, so everything is good. And Medicare for All is part of that, is trying to get to you know, we acknowledge that, and it's trying to make that easier for everything to be okay. I don't know if I said that right, but you got my point.
You did fine, Doc Murray.
Well, let me remind people, for those of you that haven't looked at your calendar, today is Malcolm X's birthday, and in honor of that fact, I went and got my special T-shirt here. I want to point out that the comments that Claudia and Susan have made about international support is critical. What's going on in Gaza and the West Bank, what's going on with the Palestinians is a major crisis. I stand with the Palestinian people, and as Black people, we should be able to recognize an apartheid system when we see it, whether we're talking about vaccinating only Israelis and not vaccinating Palestinians, or whether we're talking about the chronic oppression of the Palestinian people. So as we consider our problems, when George Floyd was killed, the Palestinians had signs up supporting that struggle, and we need to reciprocate, as many Black people do, and support the Palestinian people.
Well, with that being said, I have nothing else to say. Thank you all for coming on, and we'll see you all next month, every third Wednesday. And once again, thank my man Dre. So thanks, Dre. And see you all next month.
Thank you. Glad to have been here.
Thank you.